Welcome. Thank you all so much for joining us today at our very last of the week, Policy and Advocacy Information Session, our fifth one of the week. My name is Carly Mosby with Kentucky Youth Advocates. And during today's forum, we just ask that you stay muted, but we are taking questions and comments and celebrations and anything else you want to share with us in the chat. And if you have questions, we'll try to answer those as we go, either in the chat or afterwards in a follow-up email. So today you're going to learn more about the blueprint for Kentucky's children policies and hear from Representative Steve Riley about the 2021 General Assembly and why we need you to be an advocate for Kentucky kids. So I am now going to turn it over. We are very lucky to have the Family Enrichment Center be our co-host today. And if Lynn is on, I don't see her yet. Lynn, are you here? Maybe not. Okay.
I think Lynn had told us that she may not be able to join because of a doctor's appointment.
Got it.
So I don't know if we can all give a collective shout out to the Family Enrichment Center and all of the great programming that they do for families in Bowling Green and the surrounding area. But they have a lot of great programs there. I'm really honored that they co-hosted with us.
Yes, absolutely. Thank you so much, Jessie. And if Lynn jumps on later, we can definitely let her have a few moments to tell us a little bit about her organization as well. So we're going to start off today doing a few polls just to get our brains going and kind of give us an opportunity to connect with one another. So let me launch these polls. Okay. So the first one, just test your knowledge on Kentucky. Approximately how many kids live in this state, live in Kentucky? So I'll give it a few minutes. See what you all think. We have some pretty smart folks on the call today. Here we go. More people are chiming in now. Approximately how many kids do you think live in Kentucky? And it's okay to guess. All right. So I'll share the results. So overwhelmingly, 87% thought over 1 million kids in Kentucky or live in Kentucky, and that is correct. I don't have the exact number, but if anyone else does, they can drop that in. But yes, we have over 1 million kids living in the state of Kentucky that we are advocating for this week. So let me go to the next poll. All right, so all of you today who are here are advocates for kids, whether you knew that or not. So how long have you described yourself as an advocate? Okay, we have some variety here, good. All right. I'll end that question and share the results. We definitely have some veterans with us today. 46% are more than 10 years, which is great. And then we have some 1 to 5 and 5 to 10. I saw in the chat that somebody wanted to put since birth, which is great. I think we all can say the same. Okay. Question 3. So how many children's advocacy days have you attended in the past? All right, still have some votes coming in here. Okay, so it looks like we have some folks who have attended quite a few, so at least 5 children's advocacy days, and then the majority have attended a few at least. And we have some first timers as well, so welcome. And last question. What advocacy action are you most proud of? So we have being there for a child when they're struggling, calling my legislator to ask them to vote for or against a bill, sharing my personal experiences or the experiences of those I work with a legislator, and built support for policy change among my friends, family, and colleagues. Which advocacy action are you most proud of? And if there's any that aren't listed on here, feel free to drop those in the chat as well. All right, share these last results here. So the majority feel that the action that they're most proud of is being there for a child when they're struggling, which is great. And then we have a smattering of some of the others as well. So again, if you didn't see one on here that you are particularly proud of, feel free to drop that in the chat as well. All right, so thank you so much for participating in our polls. I'm now going to turn it over to my colleague, Alicia Watley, to share a little bit more about the blueprint and this year's policy priorities. Alicia?
Thanks, Carly. So as Carly mentioned, I also am with KYA. I'm a member of the policy team, and I work mostly on health policy issues. But today I'm going to be talking about a variety of different issues that are on our blueprint agenda. So first, we're going to be going over the policies that have not yet been filed as bills, and then we'll move into the bills that are filed that you can follow and take action on right now. So before I do that, I just want to give a little bit of background about the Blueprint for Kentucky's Children for those who might not be quite as familiar. So the Blueprint is a coalition of over 100 statewide partner organizations. So that includes our co-host today, and then many of the attendees from this week and from this session as well. So those include nonprofits, public and private organizations, and they speak with a common voice to create brighter futures for Kentucky's kids. So every year the Blueprint partners have a policy agenda during the General Assembly, which is going on right now. So the Blueprint also stands on 3 pillars, which you can see here are thriving communities launch strong families launch successful kids, and successful kids launch a prosperous future for Kentucky. So as the Commonwealth is working to overcome the impacts of COVID-19 pandemic and also address systemic racism, these policies that we have on the slides today can be implemented during the General Assembly without being included in the state budget. So like I said, these first ones are priorities that have not yet been filed as a bill. So the first one is to extend the statute of limitation for misdemeanor sexual abuse cases involving minors. So currently the statute of limitations for this is 5 years after the victim's 18th birthday. If this bill were to pass, it would extend that to 10 years after the victim's 18th birthday. The next one is to eliminate the clergy penitent privilege exemption from the child maltreatment reporting law. So this would be to ensure that any disclosures or suspicions of child abuse and neglect are reported to the proper authorities. And then we have eliminate the chain of command reporting procedures that we see in public and private agencies from the child maltreatment reporting law. So what we see sometimes is that the internal policies in organizations mandate that workers who might get a disclosure of abuse report that to their supervisor, and then the supervisor would open an internal investigation before any of that gets reported to DCBS or to the police. So this bill would basically just mandate that whoever actually receives the disclosure would be the one that's required to report it to the proper authorities. The next one is to establish a minimum age threshold for when young children can have complaints heard on them in court. So currently, children of any age in the state of Kentucky can be complained on and have those complaints brought before a judge. And we know that last year in 2020, the youngest child that this happened to was only 8 years old. So establishing a minimum age would increase opportunities to connect these very young children to community-based resources instead of sending them in front of a judge and into the juvenile justice system, which we know can just be so hard to get out of once you've been entered. And then the last one here is to minimize the impact of parental incarceration on children. And we would do this by holding parents accountable in other ways that prioritize substance use treatment and community-based alternatives to being incarcerated for certain offenses. So Kentucky has the third highest rate of parental incarceration in the country. And so we know that that means that thousands of children are impacted negatively each year by their parents being incarcerated. So this would just be an opportunity for parents to still be held accountable, but also be able to still parent their children. So those are the bills that are not currently filed, or the priorities that are not currently filed as a bill yet. And now I'm going to turn it over to Courtney, who is going to talk about the priorities that are filed as bills that we can follow at this time.
Great, thanks, Alicia. So like she said, I'm going to take the next few minutes to go through the priorities that have been sponsored by a legislator, and some have already been assigned to the committee or to a committee or like moving through already. So these are great ones to reach out to your legislators about, and ones that we hope to see continue moving through the legislative process this year. So we're going to start with House Bill 42 and 54. And both of these would allow state employees to access 12 weeks of paid family leave after the birth or adoption of a child. And there's bipartisan support for this issue, which is really great. Representative Raymond, who is a Democrat, she sponsors House Bill 42. And then Representative Nemes, who is a Republican, sponsors House Bill 54. And as of right now, the only difference between the two is that House Bill 54 says that the first 12 weeks or the 12 weeks of paid family leave have to be used within 24 weeks of the birth or adoption of the child. That's it. So we know that paid family leave allows families to be there for the important first moments of their children's lives. There are proven short and long-term health and well-being benefits, as well as proven returns on investments for employers. And we also understand that there is a bit of a racial disparity here because currently Black and Hispanic workers are less likely to have access to paid family leave than people who are white. So improving access to this benefit would boost family and economic stability for every eligible family. The next one that we want to move into is House Bill 147. And that one is sponsored by Representative Mosier, who is a Republican, and it's co-sponsored by Representative Bojanowski, who is a Democrat. So again, there's bipartisan support for this bill. This bill would allow city and county governments the option to regulate the use, sale, and distribution of tobacco products, including e-cigarettes. And we also want to point out that Senate Bill 81, which is a companion bill, was filed in the Senate by Senator Julie Rocky Adams. So currently, both bills are identical. So that means that if they both make it through their respective chambers without any changes being made, then the bill will immediately go to the governor's desk to be signed. And here's some important information. These are some things that we know. So city and county governments can see firsthand how effective tobacco control policy can improve the health of their constituents over time. So when they are given this discretion, they can respond more appropriately and quickly to local needs. They can tailor ordinances to meet those needs, and they can develop effective enforcement measures as well. There's currently a state law, though, that prohibits or preempts local jurisdictions from enacting stronger tobacco control measures to reduce tobacco use. So when we talk about this, what we're talking about is local control. So some examples of what that could include are setting standards on tobacco retailer density in neighborhoods, and then setting like buffer zones between tobacco retailers and schools or playgrounds. And this is important because we know that children are more likely to smoke if they live or go to a school in a neighborhood with high tobacco retailer density. And we know also, again, with the racial disparities, that tobacco retailer density is higher in urban neighborhoods. It's higher in neighborhoods with higher percentages of Black residents and low income neighborhoods. So in other words, kids who are low income or who are Black are disproportionately at risk of using tobacco. Next, we have Senate Bill 36, and that is sponsored by Senator Whitney Westerfield. And that one is assigned to the Judiciary Committee and actually had a hearing yesterday and was voted out of committee, which is really exciting. So this bill would expand judicial discretion when deciding whether or not to transfer a case to adult court, and when the youth is at least 14 years of age and there's a firearm involved. So right now, KRS states that judges are only allowed to consider the age of the youth, whether a firearm was involved, and whether a felony was alleged to have been committed when deciding whether or not to transfer the case to adult court. The gun doesn't have to work. It doesn't have to have been discharged. And if there is more than one person involved, even if they aren't in possession of a firearm, they'll all be held to the same standard. So under any other circumstance, using any other weapon that you can think of, judges have full discretion and they can use a list of factors to help make their determination. So these factors can include the child's previous record, their maturity, public safety, what's in the best interest of the community, what's in the best interest of the child, and then a few other things. So if this bill passes, judges will be afforded the same discretion in cases involving firearms as they are in every other case. And finally, we have House Bill 192, which is the budget bill. It's sponsored by Representative Petrie, and he is the chair of the House A&R Committee. And this would enact a continuation budget that, among many other things, will impact children's health, healthcare, their health coverage, education, and safety. And, you know, for those who don't know, when I say a continuation budget, it's exactly what it sounds like. They are trying to continue the one-year budget that was implemented in 2020 in 2021. So the Kentucky House and Senate have both passed House Bill 192, and now there are specific appointed members from both chambers who will participate in something called a conference committee. And this is just an opportunity for them to negotiate the details of the state budget before the final gavel next month. And we have a detailed budget priority checklist that we can share with each of you, but I'll also give you some of the highlights really quickly. So one of the things that COVID has highlighted for us is the need to prioritize broadband. It's essential for school, for medical, you know, we've seen that with telehealth. But currently Kentucky is 40th in the nation in broadband. So part of our advocacy efforts are around funding that particular infrastructure. We want to ensure that dedicated funding to implement the expanded care services policy to support student health remains in there. We want to sustain funding for family resource and youth service centers, or FRISKIs. And we also want to prioritize sustained funding for kinship caregivers. So this means a couple of things. First, we want to ensure that every eligible kinship caregiver knows about and receives the relative caregiver support benefit. This is a one-time stipend that can be used to purchase necessities like formula, bedding, clothing, school supplies. And secondly, we also want to ensure that front-end preventative services like respite care are always available to kinship and fictive kin caregivers when they need it. And then next, I want to just go over a few of our child welfare budget priorities, or a few other child welfare budget priorities, I should say. So the first one is strengthening funding for programs like K-STEP and START. We know that substance use has played a significant role in over half of the cases involving kids who were removed from their homes. And these programs are proven effective in helping parents to achieve sobriety while also safely caring for their children. And it's important to point out as well that for every dollar that we spend on START program, Kentucky as a state saves $2.22 in out-of-home care costs. We also want to continue funding for the HANDS program, which is an evidence-based in-home visitation program that increases adequate prenatal care. It lowers the rates of preterm birth and low birth weight, and it lowers the incidences of child abuse. So that's a really important program that we want to make sure continues to receive funding. And then we also want to increase funding for forensic services for children who experience child abuse and neglect. Specifically for the pediatric forensic teams that are based out of the University of Kentucky and the University of Louisville. This is, again, a really critical piece, as for the third year in a row now, Kentucky has the highest rates of abuse and neglect in the nation. And then finally, we want to ensure that safety net programs like SNAP or WIC or KTAP aren't modified in ways that keep children who need these benefits from receiving them. So I know that is a lot of information to go through all at once. We expect that some of these bills will have committee hearings pretty soon. As I said, Senate Bill 36 had a committee hearing yesterday. So keep an eye out for all of these, and keep using our bill tracker as well. And I think we have a few minutes. I know Representative Riley is supposed to be joining us. But while we wait for him to log on, do you all, if you want to use the chat, are there any questions that you all have about any of the information that Alicia or I just went over? Or are there other policies that you all are advocating for that you'd like to lift up right now? Doesn't look like there's any questions coming through yet. Do we want to maybe just go to the Aetna video? We can jump there and then we can circle back when Representative Riley jumps on. Okay, let's do that.
Yeah, I think that makes sense. Thanks, Courtney. Let me get back here. We appreciate your all's patience. So, while we wait, we wanted to just take a minute to hear from a Children's Advocacy Week signature sponsor, Aetna Better Health of Kentucky. And as some of you may have heard, Aetna Better Health is now serving all kids in state care through the Supporting Kentucky Youth Program, or the SKY program. And we just have a short video from Aetna Better Health with a little bit more information.
Hello, fellow advocates. We are so excited that it is Children's Advocacy Week. We are delighted to be with you here today. I'm Kelly Poland. I'm the Executive Director for the SKY program here at Aetna Better Health of Kentucky. And at Aetna, we are so excited about this week and really excited about the rally, because that's when hundreds and hopefully thousands this year, as we go virtual, will come together to show our collective support for Kentucky's kids and families. We also know there are not a lot of event opportunities for our kids to share the same stage with Governor Beshear and our House and Senate leadership. Aetna knows there's no better way to make connections with advocates who care about kids than this week. And an event like this is especially important this year, given the pandemic and the systemic inequities that we see, particularly with our vulnerable kids and families in the state. And furthermore, Aetna Better Health is honored this year to support the critical work that we know Kentucky Youth Advocates does to help the Commonwealth in their commitment, again, to meet the needs of our children and family in the state. This year is extra special for us at Aetna, because we were selected to manage the state's new Supporting Kentucky Youth program, also known as SKY. And this really means that children and youth in out-of-home care, including former foster youth, youth who are placed in kinship or relative placements, Medicaid eligible youth in the juvenile justice system, and children and youth in out-of-home care and adoption assistance youth began receiving their Medicaid coverage through Aetna starting in January. And in addition to covering Medicaid benefits, we are going to be providing a high-touch approach to care management for this population. And this really helps children and families navigate the systems and make it easier for them to get the resources that we know that they need. Our care management team is going to be helping Kentucky's children and families find local providers, schedule appointments, and even help these members get rides to and from their medical appointments. And we will also be providing extra bonus benefits like cell phones, laptops, and wireless plans to some youth so that they can maintain those very important connections to their support system. Members in SKY can also get other extra benefits to set them up for success, like GED prep classes, job training, life and financial skills coaching, and much more. Plus, we offer a few other helpful extras like our duffel bag program that's full of essential and fun items and a surprise birthday box that includes, well, we don't want to really ruin the surprise for you all. In addition to these extra benefits, we will be working really closely with the families that our youth and providers and others who are involved in these children's lives work with, so that we can help equip them with the tools they need so that together we can achieve the best possible outcomes. We will be providing free training to the stakeholders that are in the child welfare and juvenile justice systems. Some of our free training includes a trauma-informed care overview, which really provides an overview of the components of trauma-informed care and the impact of adverse childhood experiences. And another training I get really excited about is our Human Trafficking 101 training. In this training, we're really helping our participants understand what human trafficking is, what resources are available, and help them learn how to meet the complex behavioral health and support needs of this population. If you are interested, upcoming events and opportunities like these that I just mentioned will be online at www.aetnabetterhealth.com/Kentucky/event. Finally, I just wanted to mention one of the most frequently asked questions that we've been getting as we're implementing this new model here at Aetna Better Health with the state of Kentucky is really about existing relationships with providers who are not enrolled with Aetna. The SKY program is really focused on engaging our members and their networks of support. And we really appreciate the importance of SKY members' established relationships with their providers. So we would like to help maintain that relationship so the SKY eligible youth can access all of these wonderful supports and services that SKY offers, but also still maintain that invaluable relationship with their providers. So we want to let you know that caregivers or providers can reach out to us directly and reach out to our SKY provider relations team to get enrolled in our network so that the providers can continue to see our members. Our contact information is going to be on a one-pager and in our mobile app, and we will be sure to share that with you. I'll drop our phone number real quick. It's 1-855-454-0061. or reach us by email at kyproviderrelations@aetna.com. And there's no need for a special contract to provide services to SKY members. All participating Aetna Better Health of Kentucky providers are available to see our SKY members under their existing contract with Aetna. Again, we're so excited and honored to be partnering with KYA and to be partnering with all of you. I am certain that we are going to have a very powerful Children's Advocacy Week. Thank you for this opportunity to spend some time with you today.
All right. And we so appreciate Aetna Better Health and all of our sponsors during Children's Advocacy Week this past week. So I think if there are no questions in the chat or from the audience, I think we're going to go ahead and wrap up. We just laid out a lot of information for you all around our blueprint for Kentucky's children. And so what should you all do with all of the information you've heard today? We really encourage you all to take action on behalf of Kentucky kids. Contact your legislators and let them know that these issues are important to you and important for our kids here in Kentucky. Be sure to access our tools to stay connected. We only have a few events left for Children's Advocacy Week, but you can still utilize our app to keep track of those. That houses our schedule, the Zoom and Facebook links as well, helpful documents, including our blueprint policy fact sheets, and also check out our YouTube page to access recordings of all of the events that we've had this past week in case you missed any of them. Be sure to follow us on social media as well, not just through the end of this week, but through the rest of the session, so you can stay up to date on what's going on in Frankfort. And lastly, if you don't know who your legislators are, use our legislator lookup tool to find out and to get their contact information. And again, just make sure you're contacting them and letting them know how important these issues are to you. Thank you so much for joining us today and for taking the time to be with us. We really appreciate that you all are taking the time out of your busy day. Have a great day and be sure to join our final few events for Children's Advocacy Week. Thanks again for joining us.
Thanks, everyone.